Hi, welcome back to RohrichKnosePodcast, helping you become a better you. Does that mean a bigger you? Well, let's find out today from a breast implant expert on breast augmentation. Heather, welcome.
Thank you so much, Rod. It's a pleasure to be here.
Heather Furnas is a board-certified plastic surgeon. She's a phenomenal plastic surgeon in Santa Rosa, California, which is north of San Francisco in the wine country. Come visit. She's amazing. So let's talk about breast augmentation. It's certainly different than it was, 5, 10, 15 years ago. And I think the trend, at least in 2024, is that I hear from some of my colleagues is that breast implants are now getting smaller, but I don't know about that because it may depend on where you live. So tell us a little bit about what's changed in breast augmentation in the last 5 years.
That is a really interesting point, these trends. And we have found even within socioeconomic levels, there will be favored breast sizes. We found that as sort of body sizes have increased, as I've been in practice for a number of years, the implant size has gotten larger. We used to hear, I want to be a C, and now, I want to be a D. And what's also interesting is we see many fewer straight breast dogs coming. I think it may be related to, a BMI or something. We see more drooping breasts, and
right.
So breasts that also need a lift at the same time.
Right.
And so I think we do more breast, what we would call aug lifts than straight augs these days. We went through a period of time where, all we had were saline implants, and so that's what we were putting in, and now it's gel, and then there were textured implants to keep the pockets softer, and then there are issues with the texturing, and so now we've got better implants than ever, the so-called gummy bear implants, and so we use a smooth and for a while there were the shaped implants, but those had to be textured. And so the texturing is associated with a very, very rare type of lymphoma, but it's something that we have elected not to use. So we haven't used textured in years. So we use these round silicone gel implants, and we absolutely love them.
Yep.
And so do our patients.
Okay. No, I agree. And I think, smooth on implants, and they probably have the best long-term safety history going back to the 1960s and 62 in Houston. And it's kind of, we've kind of gone full circle. And, the more cohesive gel, that's what the first implants were. They were hard, cohesive gel, and then we thought we were smart and we made them thinner, and then we had all these issues. But
thinner shells.
Thinner shells, I know. All these things which we probably should have not changed it at all. And so round, smooth gel. And the other thing that's intriguing today, Heather, is that there are different profiles, and there's, we used to just have kind of what they call the moderate. Now we have a plus, a high profile, extra high profile. So tell us about that, and how do you select those types of patients?
Well, the flattest, the moderate, the flattest contour, I actually don't use because when I've seen it, it just doesn't look very natural. So the most common shape that I use is a moderate profile plus.
Right.
And the language will vary a little bit company to company. But basically what that means is it has a slight curve to it. Now, somebody who is very thin, who will show rippling, because rippling will happen in all implants. It is just intrinsic to the topology. People will say they're better than salines, but people will say, how many people end up with rippling? Well, it's 100% if you look at the implant itself, and it just depends on how much soft tissue. So some people will say, oh my gosh, I have all this rippling now, this last year. And then I say, well, have you lost weight? Yeah, I lost 20 pounds. We'll put on the 20 pounds and the rippling will go away. But the salines really did show the rippling more.
Right.
And the rippling occurs at that extreme curve on the sides of the implant. So somebody who is thinner center. That's one reason to use a higher profile that gets more to a spherical shape, and then you're going to not have that sharp arc, so less chance of rippling. The other reason to use high profile is to enhance the shape of the breast in certain patients, depending on the shape of the breast and the patient's goal and the size. As if somebody wants a really large implant, you don't want to keep on going to the side. You want to start putting that volume out front. So all of these things come into deciding what shape. It's not just a simple decision, but they're measurements and talking to the patient, getting her goals, and looking at the actual shape of the breast.
Yep. And you really summarized exactly why it's not a simple operation. It's quote unquote breast augmentation is not simple. There's so many variations. The chest size, the chest diameter, which is very important, and the patient's desires and what really looks good and what doesn't look good. And I always tell the patient, if it doesn't look good, I'm not going to do it. I'm not going to put an 800cc implant in someone who's 5'3" and has a base diameter of 11. So tell me how you determine, what's the best way that you determine the best size for your patient? What modality do you use? I know this is very controversial in the plastic surgery world.
It is.
But the viewers need to know it, and then I want to hear what you say, and I'll tell you what I've done and used for almost 30 years. Yeah.
Okay, yeah, for a little while we used Vectra.
That's a computer imaging device,
Oh, right, thank you,
Yeah.
an imaging device. We have, in the ancient days, used Tebbutt's, just strict measurement.
Measurements,
and strict measurement of implant and the chest wall. And then we started using the Rice test, which we still do. And this very old test that, I call it a test. It's not really a test.
Tell us what that is.
And I learned about it in residency. It's not my idea. But you take a nylon stocking and you fill it with the number of ounces of rice that I'll oftentimes say start at 1 cup, 8 ounces. And you knot the stocking like a knee-high stocking loosely so that you can really flatten the implant over the breast. If you put something round, because some people say, well, let's stick an implant in your bra. Well, you're stacking, and your breast is draped over that implant. So we want to reverse that. We can't drape your breast over something without surgery. So we drape that bag or stocking of rice over the breast in a bra that's not very structured or compressive. So that has really helped narrow down. And then we say, because a lot of people say, I love the size. After surgery, they go through swelling, and then they may be in tears because they're so large, and then the swelling goes away, and they realize they should have gone larger. So I have women push the envelope and then back it off. When it's like, okay, I'm going to say, uncle, it's too big, then back down. And that's the size. And then we also confirm with sizers in our office. But I found that the sizers are not flexible enough. With the Rice test, you can go home, don't look in the mirror. You have someone take a photo of you. And then when you really settled on the size, you can look at reflections in windows, shop windows. What you want to do is get outside of yourself so you see yourself objectively. And that's actually, it's a very low-tech modality, but it's really been helpful. And then for those who wish, we confirm in the office with our sizers.
Yeah, no, I think that's a great way. I mean, there's multimodality. There's not one that works well. And people, like the Vectra, the computer imaging. I also, like you, used it. And I found that it really wasn't as accurate as I thought it would be. In fact, many times it actually made the implants smaller, and then they'd come back and say, we want to be bigger. So I usually give them a range when I go to the operating room, because I still like to use sizers intraoperatively. But preoperatively, I do a lot what you do. I don't do the Rice, but I do base diameter, and then I actually do photos and that they bring me either from my website or anybody's website. And that really helps me, because I will tell you, Heather, most of the time when patients say, I just want to be a B or a C cup, and then guess what they bring you? It is like, I'm going, that's not a C cup. oh, well, that's kind of what I want. So you got to combine those things. And then the latitude of saying, I'm not going to go to the operating room and say, I'm just going to be a 342 cc. I don't do that now. Some people do, but I will tell you, I've replaced so many of those implants done by people that said, I just wanted a 340 implant and then I'm not happy with it. And everybody's asymmetrical by that way. And I wrote that article, as you know, everybody's asymmetric. Every woman, everybody's asymmetric, and you're never going to be totally symmetrical. You'll be better. So I think people need to know and hear that. And they say it's never going to be perfect, but it'll be bigger, better, and I think the implants that you mentioned are actually good to help us get to those goals, right? Because you're right, because in the past we just had those pancake implants, and they would just, the bigger they went, the further out they went. But now, with the higher profile, like you mentioned, it's now displaced more superiorly and fuller. And actually, I use more Moderate Plus and full profiles than I ever did before, and patients seem to like that. And because what they see is the fuller profile. What they don't like is the outer filling, and when they get too big. You agree?
Yeah.
Yeah.
And that's a good point. Actually, some people want that side boob, as they call it. That's not my term. And so I will also, that chest diameter is basically from the side of the breastbone to basically to almost the armpit. That's a footprint of the breast implant, and so if somebody is going a little bit wider because she wants a side boob, I will map it. I take my little caliper and I show her exactly the width. This is the width of the implant. This is the projection of the implant, so that we give them as many clues. So it's not just one method of determining sizing. And then we use sizers, and we always say, if you wake up with two different sizes, it's because we found that you really needed two different sizes. Some people have the left chest is 1 centimeter, less wide than the other. So there are all kinds of asymmetries.
Right, and that's the beauty of us, as everybody's different and everybody's asymmetrical. And I think it's so amazing that people go, really? I said, yeah. I said, look at your right eye and big eye. The one's got a big eye and a small eye. It's just the same way with breasts. I mean, but it's fascinating. So what are the three take-home points for someone who wants to have a breast augmentation, wants to find an incredible plastic surgeon like you to get the best results for them?
I would look at the site and look at the before and afters, and you want to look at making sure that the lighting is good, that the quality of the photos are good, and the standardization of the photos are good. And then if you see a post-op that you don't like, look at the pre-op. Because somebody may have one breast is an A, the other is a B, and so you see, wow, they really are asymmetric or one nipple's higher, one nipple's lower, and so whatever you are at the beginning is connected with what you look like at the end. So look for breasts that have a lot of asymmetry, and that asymmetry is really improved. Those are the more challenging cases. Right. And so that's a real artist who can do that. Also, remember that cup size, or be aware, cup size is not a scientific metric. Right. And we always ask, what cup size are you and what cup size do you want to be? And I say the reason I ask for what is your cup size now is because it helps me understand your definition of your desired cup size.
Right.
But we have had people go to be sized for bras and be sized as a B in one store and a D in another. Right. In Victoria's Secret, we just know that is like upsized. And but despite all these asymmetries and whatnot, the satisfaction rate of breast augmentation is extremely high. The confidence that you can see in a woman coming in after surgery is huge.
I agree. Well said, Dr. Furnas. I mean, great, wise words from Heather. I agree. Find a board-certified plastic surgeon like Dr. Furnas. Find someone who's going to give you all the options, be open and honest with you that you're going to be better. Some asymmetries may not be corrected, and yeah, you can't guarantee a bra size. I mean, good luck with that, right? So, and
You don't like it, cut out the label.
right, exactly. And Victoria's Secret. I know. So I always tell them, if you want to really feel good about having a bigger bra, go to Victoria's Secret.
Exactly.
So, and all right, wise words from Dr. Heather Furnas from Santa Rosa, California. Thank you so much for your time, and please send us your comments and thoughts. And if you have any other suggestions, please let me know, and I'll relay them on to Dr. Furnas. Thank you, Heather. Have a great one. Take care.
Oh, thank you so much, Rod. This has been a lot of fun.